Bones store about 99% of the body's calcium. This is very, very tightly regulated. Clotting doesn't happen unless there's sufficient calcium. Nerves and muscles don't do their job unless there's sufficient calcium in the blood. So even small changes in calcium concentration can prove fatal. The heart may stop, cardiac arrest, if the concentration goes too high. Breathing may stop, respiratory arrest, if the level of calcium falls too low. So the role of bone in calcium homeostasis is sort of to help buffer the blood calcium levels by releasing calcium into the blood plasma, using osteoclasts to break down bone when blood calcium levels decrease, or absorbing calcium using bone builders, osteoblasts, when the levels rise. So we use two primary hormones to regulate blood calcium: parathyroid hormone, which is released when calcium levels drop, and calcitonin, which is released when calcium levels rise. So your parathyroid hormone, as we're going to look at here and on the next slide, is going to stimulate osteoclast. Now remember, osteoclasts are your crashers. They break down bone, and then that calcium is resorbed back into the bloodstream. So parathyroid hormone stimulates osteoclast to break down bone. Then that calcium is released and blood calcium levels raise. Parathyroid hormone also stimulates the production of calcitriol, which is the activated form of vitamin D, and that helps us to retain calcium in the intestines and in the kidneys so that we don't excrete it as part of our waste products. So let's look at how this works. There is a stimulus, and in this case we're looking at the stimulus is something happening with blood calcium levels. So blood calcium levels drop, the parathyroid gland is going to secrete parathyroid hormone. That parathyroid hormone is then going to target osteoclast, which will break down bone in an action we call bone resorption. The kidneys are going to retain calcium. Also, the intestines are going to retain calcium. And what happens because of that? The response is that blood calcium levels raise and get back to normal homeostatic balance. When that happens, of course, then negative feedback shuts this down, and the parathyroid glands stop releasing parathyroid hormone. Now, just the opposite of that happens when your blood calcium levels raise above normal. There are cells in your thyroid gland that secrete calcitonin. Calcitonin inhibits the activity of osteoclast and speeds the way that blood calcium is taken up into the bone by inhibiting or by stimulating those osteoblasts, which are going to take that bone and take that calcium and create new bony tissue. From birth through adolescence, more bone tissue is produced than is lost during bone remodeling. So we're making more bone than we're breaking down. So the rate of bone deposition is much higher. So creating more than we're losing. In young adults, the rate of bone deposition, making bone, and bone resorption, breaking down, is about the same. As the level of sex hormones diminish as we get older and reach middle age, especially in women after menopause, a decrease in bone mass occurs because bone resorption, or breaking down by osteoclast, outpaces bone deposition or bone building by osteoblast. In old age, the loss of bone through bone resorption occurs more rapidly than bone gain. So we're breaking it down much faster than we're building new bone. Because women's bones are usually smaller and less massive or less thick than men's bone anyway, the loss of bone mass in old age typically has a more adverse or a greater effect on females. Because of this, women are more likely to develop osteoporosis. So that tells us a little bit about what's going on. You can see here in this image we have the normal healthy trabeculae, and then over here we have osteoporotic bones. Osteoporotic is simply describing osteoporosis. Okay, so you can see these bones appear to have a lot of holes in them. They're very fragile looking. So osteo, bone, pore, hole. So very holey, very fragile bones. These are going to be very, very easily fractured. On the next couple of slides, we're going to look at some factors that affect the way bones grow. And I'll tell you now, I'm not going to ask you exactly what you need magnesium and fluoride for, but I want you to see that a lot of these minerals and vitamins are needed for us to effectively make bone, and how important it is, especially during our young years, that we have all of these as a part of our diet so that we can develop as strong and healthy and thick and big bones as possible during the development. So obviously we've got to have lots of calcium and phosphates, but in addition to that, some of the other minerals that we need to produce those bones as well. So again, remember, all of this is not test, but because you have a human body and you might have kids, let's look at some of the important things that we need as well. Certain vitamins, of course, are going to be needed. Vitamin D especially. This is why your milk is vitamin D fortified, because we absorb calcium better in the presence of vitamin D. And of course, should be pretty obvious by now what you need calcium for, right? And then there are some hormones that play a vital role in forming bone. Growth hormone is secreted from the anterior pituitary, and it targets the bone and causes the chondrocytes to undergo rapid mitosis. When it does so, the bones grow, especially those long bones, and we have surges of growth hormone throughout our life, and that helps us to grow taller and to grow to normal stature. I will talk a little bit about some disorders once we finish these factors, so just a brief overview here. The insulin-like growth factor from the liver and other tissues is going to sort of help that growth hormone and stimulate that mitosis. Your thyroid hormones are going to increase your metabolism and stimulate growth. Insulin makes sure that our cells have enough sugar inside them so that we can make proteins and make the things that we need to create bone. Your sex hormones are going to cause growth spurts. So in women, when estrogen levels raise, we tend to have a growth spurt, and this happens about the age, or happens as we are entering puberty. In men, testosterone does the same thing. Women tend to grow to their full height much sooner than men, so usually around the age of 18, and that's because estrogen has a stronger effect on the rate of ossification than testosterone does. So women stop growing earlier. Men will typically grow until about the age of 25, when their growth plates have then ossified. And we just talked about the parathyroid hormone and calcitonin, so those should be obvious to you what their role in bone growth is. All right, let's talk just a little bit about some other factors that affect bone growth. Now, this type of stuff I do want you to know because this is important and pretty easy to understand. So weight-bearing exercises are going to pull on your muscles, and when it does so, it's stimulating the osteoclast in the bone that those muscles are attached to. So by stimulating those osteoblasts in the bone, the area of the bone where that muscle is going to become thicker and stronger because we're building more and more bone. This is also why a lot of the projections and processes on the bones end up developing. If you look at the bones of a newborn, they're not quite as bumpy and ridgy, and their projections are not as big. Why is that? Because they're not using those muscles as much. As children grow and become adults and we exercise and we move around, those projections on the bones become much bigger, much sturdier, because the muscles that pull on those are constantly stimulating those osteoblasts. And we've already mentioned briefly about the effect of the sex hormones and how as those levels decrease as we age, then those bones, the cells within those bones start to act differently. The osteoclast are breaking down more bone than the osteoblast. are building bone, and then we have an increased risk for osteoporosis. All right, so a bone scan, we mentioned briefly at the beginning, is going to be able to see bony tissue much better than a typical x-ray. So it's a very useful diagnostic tool that can look for conditions such as osteoporosis and other bone diseases. Just a little bit more about osteoporosis. Again, it is the condition of porous or holey bones. Affects about 10 million people in the United States. In addition to that, about 18 million people have low bone density, which is called osteopenia, but not completely fully developed osteoporosis yet. The basic problem is that bone breakdown is outpacing bone formation. A lot of this is because as we age, we don't resorb or keep as much calcium in the body, so more calcium is lost in the urine and the feces and in the sweat than is taken in the diet. Often as we age, our diet decreases, and for several reasons we may not be eating as much calcium in our diets. Bone mass becomes depleted and fractures can occur very, very easily. Just doing everyday things, for instance sitting down, may cause a hip fracture. Over 1.5 million fractures, mainly in the hips, the wrist, and the vertebrae, are related to osteoporosis each year in the United States. Osteoporosis affects the entire skeletal system, and in addition to just having fractures, it can cause the vertebrae to shrink and become compressed, which leads us to become shorter. Backs may be hunched over, and bones develop a lot of pain associated with that loss of bone tissue. All right, so what else do we want to talk about here? Oh, rickets. Okay, so rickets and osteomalacia are two forms of the same disease that result from inadequate calcification of the extracellular bony matrix, and this is usually because there's a vitamin D deficiency. Rickets is a disease of children in which the growing bones become sort of soft or rubbery, and then they're easily deformed. Because we're forming new bone at the epiphyseal or the growth plates, these may fail to ossify, and then bow legs develop. Sometimes there's also deformities of the skull and the rib cage and the pelvis, so those are common in rickets as well. Osteomalacia is the adult form of that, sometimes called adult rickets. So new bone formed during the remodeling process fails to calcify, and the person can experience varying degrees of pain and tenderness in bones, especially those weight-bearing bones of the hip and the legs. Also, bone fractures can occur from just minor trauma. So prevention and treatment for rickets and osteoporosis or osteomalacia consist of making sure you get enough vitamin D and enough calcium, and you can simply get vitamin D by exposing yourself to sunlight.